to you. How concerned should we be? I know we've been asking this question for the past couple of days. We've seen some additional spikes, but put it in context for us.
Well, look, I think we should be concerned. But when you look at states like Arizona and Texas, South Carolina, North Carolina, those are where the big outbreaks are right now. Florida, to some degree, seems to be going up. It's not a second wave. They never really got rid of the first wave. If you look at Texas and Arizona, for example, they really weren't that hard hit relative to other states during February, March. And so they just had some infection. They had persistent infection. Now we're starting to see it go back up as they reopen. I think the concerning part, well, the cases are certainly concerning, but I think the more concerning part is they haven't been able to isolate what the source of the infection is. In some states where you're seeing infection rates go up, it's related to a facility or a particular prison or a nursing home. In states like Texas and Arizona, it seems to be more pervasive, and they haven't been able to do the contact tracing to find a source or a group of activities that they're able to take action on. And that's what's concerning right now. So they haven't really been able to take effective public health action yet.
Doctor, can you explain this? And I think there's a lot of folks in the health community trying to figure it out. You look at a place like Arizona that's clearly now having spread, but then you look at a place like Georgia, which was really the first to reopen, not having spread. And you look at a place like L.A., which was one of the first places to close down, and now all of a sudden there's more spread happening there. How do you explain those differences?
Well, look, how do you explain the fact that New York had a horrible epidemic and other states, other cities didn't have the same level of spread? You know, the infection gets into certain environments, gets transmitted through certain social routes inside cities, and once it takes hold, it becomes hard to extinguish. It becomes heavily seeded, and then it becomes hard to extinguish. Georgia isn't out of the woods. They do have spread. It's been persistent. It just hasn't been flaring up. But this is the kind of virus that could flare at any time if it gets into the right environment, the right setting, and starts to propagate. Right now, you look at states, I know you mentioned this, you look at states like Georgia and Arizona right now. Phoenix, it's 110 degrees. Houston, it's about 95 degrees. And so whatever seasonal effect benefit they were going to get, they're probably tipping over right now, and more people are being driven indoors because of the heat than being able to do activities outside as well. And that might explain some of the spread as well in those states, the very hot states.
I gather there's some concern about the supplies of Remdesivir, and I wanted you to speak to that. The government's supply of Remdesivir in terms of access to it, in terms of number of people who may need it, and when we run out of at least the initial supply that's been created.
Well, it's going to depend on how many cases we have this summer. The supply that we had should last us through the next couple of months, assuming that the hospitalization rates don't go up substantially from here. It's a drug that's likely to be reserved for hospitalized patients and those who present with signs and symptoms, comorbidities that predict that they're more likely to have a worse outcome from coronavirus. And so it's going to be given to the patients who come in who present that are more sick. I think heading into the fall, we are going to have substantially more supply so that if we have another epidemic on the scale of what we had during the first go-around, there should be enough for most of the more severely hospitalized patients. But, it's touch and go to some degree. Gilead's brought on a lot of new manufacturers, and they've managed to substantially compress that manufacturing process. So we should have supply for the hospitalized patients. The same thing goes for the therapeutic antibodies. We're going to be dose limited on those as well. I think those will come onto the market sometime in the fall from Lilly and Regeneron. But both companies are likely only going to be able to supply about 100,000 doses a month for treatment. They'll be able to have more available for prevention because you need less for prevention. But most of it's going to likely go for treatment, and they'll only have about 100,000 doses apiece for treatment. That should be enough potentially for severely hospitalized patients, but it's not going to be enough to provide it to everyone who presents with coronavirus. We're going to be able to bring down the death rate if we do have a second wave. We've learned how to treat people with this disease much more effectively. So we're going to see the mortality rate come down. But unfortunately, it's not going to affect how many people ultimately get sick and hospitalized with it.